Good evening and welcome to the 13th episode of Leadership Conversations in the Development Sector. I'm Michelle Disa and I work as Associate Partner with Third Sector Partners. The social impact sector is full of passionate leaders with innovative outlooks to the world's greatest problems. Our leadership conversations focus on the unique insights offered by these leaders as they share their experiences and move the development sector forward. Our host, GoBarefoot, is an interactive web portal dedicated to the social sector. It brings together individuals, NGOs, NPOs, and CSR arms of organizations with the mandate of creating a one-stop information website for both networking and knowledge sharing. The series is supported by Catalyst, an NGO which has been preparing young women for leadership roles to create equality in opportunities and bridge the gender divide. Also, we are supported by Third Sector Partners, India's only executive search firm exclusively for the development sector. Our guest today is one of the leading lights in the development sector. I would like to extend a warm welcome to Dr. Nalini Saligram, founder and CEO, Arogya World. Arogya World is a global health not-for-profit committed to changing the course of chronic disease. Under Dr. Nalini's leadership, Arogya World designs and implements scalable science-based diabetes prevention program in schools and workplaces and uses mobile technology and social media to empower people to change behavior. As a tireless advocate for NCD prevention, Dr. Nalini leverages public-private partnerships and global platforms to improve the world we live in. Her story and that of Arogya World has been highlighted in a book, The Healthcare Gamechangers. In 2021, on her watch, Arogya World was chosen to be part of the Google AI for Social Good effort. Dr. Nalini has a Ph.D. in biochemistry from the Indian Institute of Science, Bangalore. She serves as on the Dean's Council at the Rollins School of Public Health at Emory University and is an active with the Task Force of Women and NCDs, Indiaspora, the India Philanthropic Alliance, Foresight Global Health, and the Global Center for Healthy Workplaces. She's also an Ashoka Fellow. In conversation with Dr. Nalini is Shital Kakkar Mehra, leadership expert and executive presence coach for CEOs. Shital has trained over 75,000 professionals across Asia and has personally coached across over 1,000 CXOs in the past 2 decades. She has conducted workshops for diverse organizations across Asia and has been invited as speaker by leading B schools and professional associations. She's a best-selling author, and her latest best-selling book, Executive Presence, The Poise Formula for Leadership, is India's first research-based formula on this leadership skill. She's an active philanthropist and social entrepreneur. Over to you, Shital.
Thank you, Michelle. Thank you. Welcome, Nalini, to the session. It's an absolute pleasure and an honor to have you here. So I'm going to start with my first question. You have more than 4 decades of experience in the healthcare industry. Our listeners will be very excited to hear your 3 biggest learnings as the founder and CEO of Arogya World.
Shital, it's a real joy to be here today. Thank you, Michelle, for the invitation, and Shital, I really look forward to this conversation. So when you said 4 decades, I was reflecting on it. My goodness, I feel so old. But really, you know, my first learning from the years with Arogya World has been that age is simply a matter of attitude. If you are enthusiastic and curious, have a zest for life and a sense of adventure, you're young. I was more than 50 years old when I started Arogya World. And, it really doesn't matter if you have a deep sense of purpose and you want to leave the world a better place. It doesn't matter how old you are. So that's my first learning. The second is, leaders should seize opportunities. I think that's probably one of the best things leaders can do. Strategy is important, but seizing opportunities, recognizing them as opportunities and running with things is one of the hallmarks of being a leader. So we at Arogya World attribute a lot of our growth to seizing opportunities. Right at the launch event, for example, in 2010, I really moved very fast on a chance introduction to somebody who had come to the launch party, who said, I can connect you with Nokia, and said yes to Nokia's big request, and went to Emory University, got the content written with them, and then started our mobile technology. It was a chance introduction to someone at a party, that led us to take up mobile technology in such a big way. The other is, purpose. I really feel leaders should have a very deep sense of purpose, and we all do in this sector. And that is one of the most beautiful things of working in the development sector. I get up every morning feeling so privileged that I get to do the work I do. I think I've been working for more than 10 years pro bono on this, on Arogya World and our work, and advancing that mission, seeing the difference we are making on the ground really fills me with joy. I am genuinely energized by what the day will bring for me every day. And I started on this as by being inspired by the life and introduction to a Dr. Bill Fagey at Emory University. He was a professor, he was the ex-head of the CDC, a really big, leader in global health. They introduced him as somebody who had conquered or eradicated smallpox. And I said to myself, what a wonderful mission, to be more than somebody's wife or somebody's mother, or to be more than a player. I was working at Merck at that time, in a big corporation. And to really take up diabetes as a very formidable foe that I will put all my energy into and make a difference. And I'm really excited about the front row seat that I have had, and to watch all the development in India and to be part of the equation here. It's really exciting. But yeah, sense of purpose is critical, and that is what drives us today.
Wonderful. Also, your energy and enthusiasm is infectious. That's what Third Sector Partners team have said. So yes, couldn't agree with you more. I'm going to move to a very critical aspect, which is that the social and corporate, the divide between the social and the corporate sector is breaking. So what are some of the processes that the development sector can take from the corporate sector? And of course, vice versa, what can they learn from the development sector?
Yeah. So I have worked in both the corporate side and the nonprofit side. And what I think is important in the development sector to copy from the private sector is a sense of measurement. Measurement is important. Results matter. It's very often my colleagues and others will say, hey, I've done so much. There's so much activity. I've worked the whole week. That's fine. That's great. But what was the result? So the standards we put to measuring impact in the real world, that is very important. What difference did we make to the lives of people? Yeah, we reached so many people with this much education material, but what did we really do to help them improve their health? That is important. But same standards for the team. Hey, what did we achieve? So results matter, and that measuring our activity is also really critical. Then business rigor, accountability, that is something we can really learn from the corporations. and that not performing should have consequences. Very often in the nonprofit world, we don't move with a sense of urgency. So these are all things we can learn. And the last thing I'd say is that we can learn how to build brands from the corporate sector and how to scale. They are incredible. They can sell sugar water and make it cool and prized and coveted. And we really should see how to make fruits and vegetable intake. That's our mission, is to prevent non-communicable disease, prevent diabetes through healthy living. So we teach people how to eat healthy food and what is the meaning of healthy food and what is the meaning of physical activity. So these are the things we push. So how to make them cool and sexy, that's something I think we think very hard how to work with and copy the teachings from the corporate sector. The other way around, I think corporations can learn from nonprofits about motivating their people with purpose. So making them understand the mission and really keeping people, because people join companies now for much more than a paycheck. So engaging with them, using and showing that they care for the employees as well as the communities they work in. And truly, doing well by doing good is, I think, a really great mantra that they can copy and learn from the social sector. And then this Michael Porter's shared value is, I wish more companies would really embody that, because you can make incredible financial progress while also improving the communities and countries and where you work. And that is becoming, they can eradicate poverty if they can just stimulate social progress in all their locations. So it's something that they should, I wish they would do more.
Wonderful. Superb to hear your comments on that. I'm going to take it a step further. And we have seen during the pandemic that even governments had to work closely with both the corporate sector as well as the development sector, whether it was vaccination drives or awareness building or using masks or any of that. So what can the governments learn from the nonprofits?
Yeah, this is something I feel passionately about. I feel that governments should really consider nonprofits as a very important ally. And especially in this phase of building India back better or building any country back better, the government should really do something called multi-stakeholder collaboration. I mean, the problem at hand is so big that no one entity, not even the government, can do it alone. So they need allies, they need partners, and nonprofits are very good partners in taking things to the last mile. And there should be that value and appreciation of this. Non-communicable diseases, for example, affect. This is a space I work in. They affect 2 out of 3 deaths in the world are from non-communicable diseases. In India, diabetes affects 3 out of 4 adults in metros. And, so you may not even know that you're diabetic or pre-diabetic and you're walking around, 3 out of 4 are either diabetic or pre-diabetic. And so the problem is so big. You can't treat your way out of this. So prevention is very important, especially because we know that diabetes is preventable with 3 lifestyle changes. You have to eat right, exercise, and avoid tobacco. So when you don't need a new technology or a new vaccine, you just have to get the message to people and make healthy food accessible, make the healthy living the default choice. Then and that prevention is smart. Then the government should really take it up, particularly now at the back end of COVID, because there are so many links that have been shown between COVID and diabetes as well. So preventing diabetes now is probably even more important than ever before.
Couldn't agree with you more. Technology has been a very big game changer in the social sector. So how has it impacted Arogya World?
So it has really, we have embraced technology in every way. So we have built a backbone for technology, and we use it for getting applications for our healthy workplace program, for example, for showing reports, for data visualization. We collect our schools impact data. So we have a schools program. I should tell you what we do. We take prevention to people where they live, learn, and work. We call it a doorstep health approach. So we have a schools program, a diabetes, a healthy workplace program, a text message program, and a social media led My Thali program. And all of these, you will see that we have, but the backbone is technology. So it's not just for reports or collecting data that we use technology, but we also you really use mobile technology for education. So we did a 1 million person experiment with Nokia some years ago, and now we have used this M-Diabetes program in many ways. We're using WhatsApp. And as Michelle said, we've also started using cutting edge technology like artificial intelligence to see how we can improve the effectiveness of our text message program. To get more people to appreciate and adopt health behaviors. So the other thing is social media. We use social media for education, not just for promotion. So we educate people on healthy eating. My thali is a picture of a thali that shows roughly what quantities of food, cooked food, somebody should eat. Particularly women. And we do this to urban women, working women. We promote My Thali through social media. We have chefs on board, we have foodies clubs on board, and we've adapted it also to rural girls. So in every way, we are using the technologies. The last thing I'll say is schools. So when COVID hit, we had a schools program where we were going in person to schools and with our partners and getting the school children to understand the basics of healthy living before their lifestyle habits are fully set. So we go to 11, 12, 13-year-olds, 6th and 7th grade children. And so that entire thing stopped because the schools were closed. So we digitized our programs. Our programs are games and activities that the children play to really understand. So we adapted it all to e-learning games, and now we are working with digital programs to reach school children in Goa, throughout the state of Goa, also in Maharashtra, in Thane district. So we are working hard to scale. The technology is helping us scale. It is helping us improve efficiency. It's helping us capture data and visualize the data. So we are using
wonderfully.
Yeah.
So you've worked in the healthcare industry in both the US and in India. So it'll be wonderful if you could share your views on how both these countries view the non-profits.
Thank you, Shital. So the US, let's start with that. There is a real value society places on nonprofits. So they are coveted, they are respected. There is an appreciation for the work. They think it's great work that nonprofits do. There's social capital associated with being a nonprofit, with being on the board of a nonprofit. Lots of executives work really hard, and galas and everything are very well attended, nonprofit galas. So the IRS, which is the Internal Revenue Service, also gives a lot of cuts a lot of slack for the nonprofits. So all in all, the government, society, everybody, works in tandem to let these nonprofits flourish. In India, I wish, if there's one wish, it would be that maybe there should be greater appreciation for the value that nonprofits bring, because they have demonstrated it now, especially in COVID times, as you said, but also because they should be viewed as true allies to everybody, to the private sector, to the government, and, can't do it all alone. And so if there was a little bit of a loosening of some of the regulations and the difficulties that nonprofits find themselves in, it would be really great.
Thank you. Donor profile has also changed in the past few years, and COVID has accelerated this change. It'd be wonderful if you can share your thoughts on the funding and the donor profile in India, as well as, of course, in the US.
Yeah. So in the US, the individual giver is the main source of funding for nonprofits. Corporations give about $88 or $19 billion, and then foundations give some, or the other way around. Anyway, they are small, but the biggest chunk, more than approximately $400 billion, is from individuals. So the individual giver is the big giver, and Americans by nature and by upbringing are very, very generous. The average American gives 4% of their annual salary to nonprofits. So sometimes in their own community, very few of them, of course, to global causes, but yes, they do give a lot. In India, there is approximately equal weightage given to whether it's a foundation or a corporation or foreign aid or even the retail giving. It's roughly equal. I think the private foundations are a little less and the others are a little more, but they're roughly equal. And what is exciting is that the high net worth individuals and the private foundations, family foundations, are actually increasing their giving, and that is an area of real growth. And it is wonderful to see that the foreign aid is now not the biggest chunk of the monies, and that CSR is, especially with the 2% rule, is very exciting. But also the individual giving is increasing. In COVID times, the retail giving went up so much, and it was exciting to see that. So I think it's fair game to go after the retail giver, to go after the corporate giver, as well as the family foundations. And it's very, very, it's a thriving ecosystem.
Yes, that's very true. Last 2 years, we've seen a lot of donations, and people have been pushing for causes. Somehow COVID did seem to bring out a lot more donation than we've ever seen, even of small quantities. So agree with you. And now COVID has also impacted leadership principles. So how has leadership evolved to rise up to this challenge?
Yeah. So today, I think we realize that we need thinkers, but we also need doers. So leaders today must be thinkers and doers. They must have strategy, they must be able to think, but they also have to pivot very quickly and deliver. And COVID showed us that we had to move, at lightning speed to deliver the solutions and the services. And the other thing is collaboration. I really, really believe that, we can't solve these big, problems. We want to make deep societal change. We want to make population level change. Can't do it alone. So we have to work with other NGOs. For example, if we have a school health program and education NGOs are going every day to schools, so we can piggyback with them. We get a very smart way and low cost way of reaching our content to schools and to school children. At the end of the day, they want to get the child educated, to have a successful, and be a contributing member of society, and so do we. We want the child to learn healthy habits and be a positive contributor to society. So there is, a real synergy there that we should do. We should also work with government, not be afraid of government. We should also work with the private sector, truly, because there is a synergy between all the players. So collaborating and working with all of them is very important. And as I've said a couple of times already, impact is critical, has been critical, and I'm a scientist at heart. And for me, measuring impact is core to, the fundamental value that we ascribe to impact in Arogya World. So we really measure impact. Reaching 6 million people across India doesn't mean much if you haven't helped them improve their health. But we know that our schools program gets us 15% impact. Our diabetes program improves 20% of health behaviors. So there is a real idea of the difference we are making on the ground. And that's important, more important now than ever before. We should really think of ourselves as being in the impact making business. And the last thing I would say is fundraising. So I'm realizing more and more that raising funds is one of the most critical things, today nonprofits face. We are facing existential threats in some ways. So we have to be very, very good at raising funds. We have to give it a lot of importance, but more than anything, we also have to be ready to pivot, to a for-profit enterprise, become a social enterprise, and, think because the world of finance and development is changing. And so we should be ready to embrace all that. So.
True, very true. And my last question to you is, we have a lot of young professionals from the NGOs, NPOs, CSR cells of organizations, young motivated people from the sector who are a part of our audience. So what is your advice to the rising stars of the social sector?
So the first thing I would say is you must think big. There is not much that comes out of aiming low in life in general. So think big, make big goals, but deliver on them, really think it through and deliver on them. And you don't have to be big or be part of a big organization to think big. You can, take up, hey, I'm going to dedicate the rest of my life to defeating diabetes. Well, that's a very, very big goal. But a single individual can take it up and, really make a difference. And that's what I would say is don't think small, please, think big. And then really one person's vision can make a difference. So don't think that you have to be a big corporation or a big NGO to make a difference. One individual can start a whole series of activities and make a difference, particularly in our space. It's really exciting to watch how innovative people are. Just to give you one example, when we digitized our school program, we found that it was very difficult to reach the digital program to the school children. Schools were closed. And so we went to our partners. Some partners started using WhatsApp groups, but hey, the child has to wait for the father to come home and their phone is the only one. And as you know, it's the boys that get the first dibs at that phone rather than the girl's child. So there's a lot of issues of even accessing the digital, technology. But one of our partners, they came up with something really exciting. They decided to go into the village community because this is Child in Need Institute in Calcutta, in the West Bengal area where they were working. The digital access was low in those communities. So they decided to go into the village community and deliver the program rather than actually, going to schools. So, hey, it worked. So you can think, in a very innovative way, right at the community level, and deliver and, implement your program. So that's the other one. And the only other point I'd like to make is use your spheres of influence wisely. Each one of us has a sphere of influence. We have a group of people we can influence. You may be starting out in life, you may be, at the fag end of life, but you can really influence people. And you should use those spheres of influence. Some people do it very well, some others not so well, but don't keep it to yourself. Really spread your words of wisdom and your abilities, really influence people to follow you. And that, I think, is something I tell my daughters. There's no point. We should live life to the best of our potential. Really, nothing less will do. So we should, I hope I am living life to the best of my potential, really, because that is the only way we should live.
Wonderful, wonderful. We have a couple of questions now. Yashi from Yashi Saxena would like to ask you a question. So could we please have the spotlight on Yashi?
Dr. Saligram, so nice to hear from you. And thank you for taking out your time and having this conversation. So my question is that your focus on lifestyle change is something that is extremely intriguing to me. What would be certain lifestyle choices that you would say are most common among leaders of today?
So really, whether you're a leader or you're just starting out in life, honestly, the best decisions you can make for yourself are to eat right, exercise. And that is becoming the thing, I think. Also, it helps you with grounding. It helps you with your mental health. And in COVID times, it has become, for me, crystal clear. Hey, you can prevent non-communicable diseases. You can prevent diabetes. The World Health Organization says 80% of diabetes and heart disease can be prevented with 3 lifestyle changes: eat right, exercise, and avoid tobacco. So if we can do that, then we can really, tackle diabetes. We can put ourselves in the best position to boost our own immunities and prepare our bodies and our communities for the next pandemic. So it is becoming clear to me that healthy living and making individual choices, as well as if you're a leader, to make your company, if you're a corporate leader, to make your company a healthy workplace, for example. These are decisions that we can make, and we are faced with this every day, every meal, every time you reach out to grab that snack. You have to make that choice, and it is not easy. It is the holy grail. It is the most difficult thing. Behavior change is the most difficult thing, but it is a must. So we start young. We start with school children. We go to workplaces where the average age is 25. So we need to get them all hooked onto healthy living before age 30, because that's when in India we start getting diabetes 10, 20 years earlier than the rest of the world. So we have a real problem, and we should tackle it with healthy living. Fortunately, as I said, we don't need a new vaccine or a new technology. We just need to make decisions ourselves.
Thank you. Thank you so much. That's extremely insightful. Thank you, Shital, for this opportunity.
Thank you. And we have one more question from Mehra. So could we have the spotlight on Mehra, please?
Hi, Shital. Thank you, Dr. Saligram. It was really nice to hear your views. Yeah. So my question to you, Dr. Saligram, is as a leader, how do you really keep your team motivated despite a lot of obstacles and challenges, especially in the social sector when the challenges are multifold? So how do you keep your team really motivated?
Yeah. So, I think the unifying thing in our sector is the sense of purpose, right? So we have, our purpose is actually embodied in our name. Arogya World means we wish for a world free of disease. So every day we are confronted with our purpose. Hey, we are working to free the world of disease. We've chosen diabetes, but it's any disease. And the people who join us also are passionate about health, are passionate about making a difference. So I couldn't do this alone. Every single person who has joined us, whether it's on the Healthy Workplace team or the schools team or the MyThali team or M-Diabetes team, we have 4 key programs, and we're starting a 5th. We are starting something called Arogya City, making Bangalore the first Arogya City. And it's really quite exciting to watch all the people have the same, sort of passion and sense of purpose. And it's just, then it's easier to row the boat in the same direction. All of us are working to propel the ship forward, and it's much easier to do that. When it's once in a while, it hasn't worked out, and we have, people have left us. But by and large, those who have joined Arogya usually stick around because of the work and the purpose. And that's, I think, the most important reason.
Thank you.
Thank you. And we have a question in the chat box. What is the most important trait you look for when you're hiring a new employee for Arogya World?
Yeah, I look more for values and this kind of a desire to contribute to health and to improving the health of people. Because if that desire is not there, it's very difficult to really engage in our mission. So that is very important. I really don't mind so much about skills. We can always teach them our program and get them up to speed. But if the core values, and in our case, integrity is a very important part of it. We have to get a lot of work done, but we do it ethically, and we are sincere about our measurements and our impact evaluations. So it's more the values and the sense of integrity that and passion that I look for.
Thank you so much. We've run out of time, but not out of questions. So thank you so much. Really appreciate the unique insights you've offered on leadership, and wishing you all the best. And thank you to our audience for joining us today. Thank you, and stay safe. Thank you.
Thank you very much. I thoroughly enjoyed this. Thanks a lot.
Thank you.
Thank you.
Thank you.
Thank you so